All right, I think we're in good shape. Welcome, everyone. Sharon, I'm going to pass this on to you. Your time.
Good afternoon, everyone. I'm Dr. Sharon Levine, the section head for geriatrics in the Division of Palliative Care and Geriatric Medicine here at Massachusetts General Hospital. And it's my pleasure to welcome you to today's Senior Health Town Hall. To our patients and our visitors, welcome. I saw a patient this week who's been enjoying these town halls from another country, and that makes me so happy. Patients are coming back to clinic, and it's wonderful to see those of you who've been able to get in. We're almost 10 months into this pandemic, and I'm so happy that we can bring all of us together. Today, we'll be doing our usual COVID updates and talk about grandparenting during these very challenging times. And most importantly, we're going to talk about voter information because it's really important to exercise our privilege as Americans and to be able to vote safely, however we do that. And for those of you who are pollsters, thank you. I don't know about you, but I always feel great on election day. I just feel terrific. Today's medical grand rounds was about the same topic. So welcome to you all. Happy to see you. And without further ado, I will pass this on to our moderator, Dr. Susan Edgman-Levitan. Take it away, Susan.
Thank you, Dr. Levine. So my name is Susan Edgman-Levitan, and I'm the director of the Stoeckel Center for Primary Care Innovation at Mass General. And I'll moderate today's town hall. One quick idea, given what Dr. Levine just said about people watching this from other countries, if people are interested, please share where you're viewing from in our chat so we can see how global our town halls have become, if they have. So a few housekeeping rules before we get started. We mute everyone to eliminate background noise. We know that you can't always manage everything going on around you. And so we want to be sure that things are quiet for our speakers. You can view the speaker on your full screen, hopefully as you're doing now, or you can go to the gallery view in the upper right-hand corner, click on that. It looks like a little chessboard, and then you can see all of the participants. If your picture becomes jumpy or out of sync, click Stop Video in the lower left corner, and that will speed up your connection. For questions, and we really encourage you to write all your questions in, please use the chat feature that's in the bottom center of your screen. But we also ask that you not share any personal medical questions, don't show us any body parts or anything like that, because anything you write in the chat or you show on the screen can be seen by everyone that's viewing the town hall. And if you do have a medical question, we really encourage you to reach out to your doctor directly. So we look forward to all your questions and we'll do our best to answer them. And if we don't have enough time to answer everything, we try to send out information after the call. So I'm going to move on to introduce our excellent speakers so we can get started. So in order, we will hear from Dr. Andrea Serinello, who is an associate professor of medicine in the Division of Infectious Disease at Mass General. She will then pass it over to Dr. Ode Hennon, who is the co-director of the Child Cognitive Behavioral Therapy Program and the director of the Child Resiliency Program at our Benson Henry Institute. And then we'll hear from Michael Festa, who is the state director for AARP, and he is going to be talking about everything that we can do to make sure that we exercise our right to vote. And then he will turn it over to Dr. Matt Russell, who's the clinical director of the geriatric section and the medical director of senior health at Mass General. So with that, let's begin with Dr. Serinello.
Hi, good afternoon. Thank you very much for having me. I am one of the infectious disease physicians here at Mass General, and I've been involved in our clinical response to COVID since March. And I've also been working quite a lot with a number of school districts around Massachusetts to help them think about safer strategies for reopening in person. So I'm eager to hear about the resilience issues for children as well that will follow on this part of the meeting. So I think my job is to give some updates on key issues related to COVID from a clinical infectious disease standpoint. And we got a few questions in advance of the meeting. So what I thought I would focus on today is a little bit of kind of clarifying some definitions that we hear a lot in the news. Things like, what is isolation and quarantine, and what does a test help you know and not help you know? So I'll talk a little bit about that, and then I was going to talk a little bit about flu shots, sort of how important they are, what kind we need, things like that. And then I'll probably save some of the other issues that have come up in the chat for the Q&A session at the end. So just to kind of think a little bit about some of the terms that we hear all the time these days, especially in the news, is people talk a lot about quarantine and they talk a lot about isolation. And those words get used incorrectly and confusingly, I think, quite often. So isolation means what we should do for somebody who has COVID or who has symptoms that very well might be COVID, but they're not able to get a definitive test. And in that case, people need to stay isolated at home for 10 days. And that means, as much as possible, stay in just one part of your house. Try not to have contact unmasked with anybody that you live with. If you can, try to have your own bathroom. Sometimes that's impossible. We know we have a lot of patients in shared housing situations where that's not possible. But as much as possible, to try to stay away from other people for 10 days. And if you have symptoms, that 10 days starts when your symptoms started. If you never had symptoms and you got tested for another reason, then those 10 days start whenever you had your positive test, because that's really the best we can do. And then for a very small number of people who were very sick and were admitted to the hospital, it's not 10 days, but rather 20 days. And so I think that's important to say because in addition to those 10 days, you also need to not have a fever for at least 24 hours. And if you had other symptoms, those symptoms need to be improving. And it's really about the time. There's no role for a negative test to tell you when that isolation period is over. So we've heard an awful lot about, whether certain politicians have tested negative or whether their families tested negative. And does that mean they can then go on and be out in public? And it actually doesn't matter at all. Some people will clear their tests. Their tests will become negative very quickly. They still need to stay home for 10 days. Other people will have a positive test for months, and they're not infectious. They can go out after 10 days. So the reason is because there's never been any documented transmission after 6 or 7 days since the beginning of symptom onset. And so they also can't identify virus that's actually alive. Even if your nose test is positive, they haven't been able to find virus that can actually grow and replicate and infect somebody else. After, for most people, it's about 8 days. For a few very sick people, it was about 20 days. So that's where those recommendations came from. So it's really about the time and not about the test. So that's isolation for people who have COVID or may have COVID. And then the other word that gets used a lot in interchangeably but means something different is quarantine. And quarantine is for people who have been exposed to COVID. So that kind of exposure could be, for example, a close contact, someone that you were within 6 feet of for 10 or 15 minutes or more, or someone that you hugged or kissed when they were infectious. And quarantine means you need to stay home for 14 days. And you should get a test during that time, because if your test is positive, then we need to find and quarantine the people that you have been in contact with. But if your test is negative, you still have to stay home for 14 days. And so that's another thing that I think we've seen sort of misinterpreted in political and public spheres of late. Again, the negative test there isn't helpful. The quarantine still needs to be 14 days. So I wanted to distinguish those two things because I think that's confusing. And then I also just wanted to talk a little bit about testing. So what tests do we have available? How can they be used? There are really three kinds of testing that people talk about. The first is diagnostic testing, and that is for anyone who might have symptoms that could be consistent with COVID. So if you wake up and you have a cough or a fever, any of the other symptoms on the CDC list, which include a number of things: runny nose, sore throat, fever, cough, trouble breathing, some GI symptoms like nausea, vomiting, diarrhea, headache, and most notably is the sort of famous one about loss of your sense of taste or smell. If you have any of those things, you should talk to your doctor. Most likely they will ask you to come and get a COVID test. And that will be a diagnostic test because we're doing it to evaluate symptoms. And it's best to do that as soon as possible after your symptoms start, because the test is actually most likely to pick up COVID in those first couple of days. If you wait a long time, it'd be less likely to be accurate. And there's a couple different kinds of tests that one can get. You've heard about these rapid tests. Those are not recommended for when you have symptoms because they're just not as accurate. They have a lot of false negatives. They also have a lot of false positives. So if you have your care through the Mass General Brigham system and you come here, you will get what's called a PCR test, which is a laboratory-based test, which is the most accurate one that we have. Most of the time that's some kind of a nose swab, whether it's like all the way back nasopharyngeal swab or just in the front of your nose called an anterior nares swab. And then many sites are also doing saliva testing, and any of those three kinds of swabs are fine. And then the other kind of testing that you'll hear a lot about is called screening. So this is testing repeatedly people who don't have symptoms. And this is what we've heard a lot about for politicians, for example, for professional sports teams. This is what a lot of the universities are doing. And the idea there is to try to pick up somebody during the time that they might be infectious with COVID. And here people are using those rapid tests, and they're a little bit less likely to pick up COVID, but that's probably okay if you do them often enough. Because they're probably more likely to pick up people who have a lot of virus in their nose or their throat or their mouth. Those people are probably the ones that are most likely to be infectious. And then if you do it often enough, if for example, I get tested today, but I just don't have quite enough virus yet to be detectable, but I get tested again tomorrow or the next day, I'm likely to be picked up then. So the rapid tests have some, I think, good roles there. But the most important part of screening testing is to realize that a negative test really doesn't tell you that you should do anything different than what we're telling everyone to do. So even if you have a negative test doesn't mean you can run around and hug people unmasked. And I think this may be important if people have visitors who are coming, family members, for example, who are going to get tested as they enter Massachusetts. That is great, and it gives a little bit of reassurance. But it is still possible that the test could just have been falsely negative, or that a person might not quite have enough virus yet to be infectious, but they're going to be infectious in 6 hours or tomorrow. So even if you get a negative screening test, you still need to wear a mask, keep your distance, wash your hands, do all of those safety measures. And I think that's where we saw, for example, some of the White House screening strategies fall through, where people got a negative test and then felt like they didn't need to do those things. And so I wanted to emphasize that as well. So those are the two major kind of tests and the sort of important reminder about the definitions of quarantine and isolation. And then in the last couple of minutes, people wanted to hear a little bit about flu shots. And so I thought I would just change gears a little bit and talk about that. We know it's really important for everyone to get a flu shot, especially important for people who might be at high risk of getting complications if we got the flu. And those include people over 65, as well as people who are pregnant, people who live in any sort of residential facility, and people with medical conditions such as lung, kidney, heart, liver conditions, immune disorders, things like that. And there are really two things that determine how well a flu shot will work in any given year. The first one is how closely it fits the kind of flu strains that are going to be circulating that winter during the flu season. And then the other is the dose of the vaccine. So the fit of the vaccine has to do with how well the CDC every year kind of guesses which strains are going to be circulating. There's sort of nothing we can do about that. They do the best they can. But you know, the previous traditional flu vaccines have included 3 strains of flu. So 2 flu A strains and 1 flu B strain. This year, there's another vaccine available called a quadrivalent vaccine that tackles not only 2 flu A strains, but also 2 strains of influenza B. And so that's likely to have a better fit to whatever flu virus one might encounter in the coming flu season. And then there's dosing. So there are 2 doses available of both the trivalent, the 3-strain vaccine, and the quadrivalent, or the 4-strain vaccine. And if it's possible, I think it's recommended that people, especially people over 65, get the quadrivalent vaccine. So if you can find it, I think that's the better one to get. And then if you are older, over 65, or if you're taking a statin, a medication for cholesterol, it's recommended that you get the high dose of whatever vaccine you can get. And so ideally would be the high dose of the quadrivalent vaccine. But I know people are having a lot of trouble getting access to the quadrivalent high dose vaccine. Like, some pharmacies are out of it and it's been difficult to get. And so I think most infectious disease doctors would say the most important thing is to get some flu vaccine. If you can get the high dose trivalent or the high dose quadrivalent, those would be preferable. But if you're not able to get the high dose quadrivalent, I would definitely get whatever one you can get. So it's probably worth waiting maybe another week or 2 to see if your pharmacy will have the one you would most like to get in stock. But if not, then I would just go ahead and get any flu vaccine so that you have some protection in place as the flu season starts. So I think I'll stop there because that's our first allotted time, and I'm definitely happy to answer questions. Please put them in the chat. We'll come back to them in the Q&A. And I'll turn it over to Dr. Hennon.
Thank you so much. That was so informative. I learned a lot listening. I always enjoy these town halls. And thank you, everyone, for participating and for the opportunity to talk with you about mental health and ways to support kids during these challenging times. And I think you all know that this has been very stressful for everyone, including children and adolescents and young adults. And so it behooves us to think about how we can all help support kids and families, since we're going to be in this a little bit longer. We're not quite done yet. You know, the thing I want to emphasize, however, is I truly believe, and I think the data bears out, that most kids are going to be okay in the long run. This is a very difficult time, and certainly, you know, a lot of kids are struggling in different ways, but we know that people are resilient. We're designed to do this. And just because we haven't had to do this kind of thing ourselves doesn't mean that humanity hasn't done this for forever. So I do think that most kids over time will be just fine, will recover, will catch up on anything they're missing, and go on to have happy, productive lives. You know, and so the question is, how can we make this as painless in the interim as we can? And I think grandparents play a critical role in this. I know as a mom of 2 teenagers, I've been so grateful to my family and my parents for the time that they're devoting to my kids, and you know, and the richness that they bring, actually in some ways more than they did before. So we are all on Zoom right now, and I think before this, I don't think that my family would have ever thought about interacting via Zoom. And in fact would have run away as fast as possible if we suggested this. But now we're all doing this all the time. And it's actually given my kids an opportunity to interact one-on-one with their grandparents in a way that they didn't do before, and to find creative ways to engage them. And I know my mom was just saying how much she's enjoyed interacting. She has 11 grandkids and each is so different. And she gets to interact with them one-on-one and really get to know them and their personalities in a different way. So I don't mean to be Pollyannish about it, but I do think that there are some really interesting outcomes that are positive that I hope will continue long after COVID ends. And I think particularly if families are separated and far apart, this has been a nice way to ensure that there's ongoing connection. So having said that, what are some of the things that we might want to think about with kids? So a lot of kids are very anxious. They are worried. I know a lot of kids are worried about their families, are worried about their grandparents and what's going to happen to them. worry, that if they watch the news and they see what's happening, they're expressing a lot of distress and concern about that. I think kids also have all the same worries that they've always had. So just because there's COVID doesn't mean that they're not worried about grades and worried about friends and worried about their hair and worried about all of the things that they worry about. I think there's a lot of worry about the world in general. There's been a lot of exposure for kids to a lot of ugliness, and that is definitely weighing on children across the age range. And kids have had a lot of loss. So for children, not being able to do their graduation, not being able to celebrate their birthdays, not being able to see their friends feels very much like loss for them. And so what we've really been thinking about is how do we help develop skills that we can all reinforce to help cope with this? These are real fears. These are real losses. I think we want to validate them and share with them that we understand how hard this is. And at the same time, promote strategies and promote tools that they can use to manage this, right? So whether that's maintaining regular routines, still getting up in the morning, getting dressed, not spending the whole day in your pajamas, which I had a number of my patients yesterday show me they were wearing shirts and pajama bottoms, which was not quite what I had in mind. Still getting outside, trying to get some sort of physical activity. All of the things that we know are so important for kids of all ages at all times, and not letting all that go by the wayside just because we're home together all the time. I think there are a number of tools that we can teach in terms of how you think about the situation. So we know that the thoughts that you have in a situation have a lot of impact on your feelings and your behaviors. And so if your thoughts are, for example, this is never going to end, I can't do this is hopeless, it's going to be very hard to do things that you need to do to take care of yourself. So an alternative to that might be, this is hard and it is a big pain, but this will end. I just need to take it one day at a time. Or to think about, what can I do to keep myself occupied and distracted? And this is where I think grandparents are key. There's so many things that grandparents do with kids that keep them occupied, connected, distracted, and can help sort of shift that dialogue. I think that as adults, we need to also be mindful of the messages that we're sending. So whether it's talking about world events or talking about school or really thinking about, are we promoting a healthy approach to this, or are we sharing our own distress and anxieties and frustrations all the time, right? Which is easy to do. There's a lot going on right now. So being mindful of the messages that we're sending. So for example, if we're frustrated at a school system for whatever decisions they're making, rather than saying something like, the school has no idea what they're doing and they're idiots, which then is going to create a lot of anxiety for the child, saying, there is no one right size fits all. We're figuring this out together. We're in dialogue. We're going to have to be flexible. And so I think really modeling for children the kinds of approaches that we want them to use. And I think recognizing that there isn't one size fits all. No one really knows the best way to do this. And so I think being very compassionate and kind, that everyone's muddling through as best as we can. And a lot of the choices that parents and schools and others are making aren't clear. And so helping children tolerate that uncertainty and letting them know that they're supported. We may not have all the answers, but we're there with them and we're going to figure it out together, so that they don't feel alone and confused about all of this. And I think that's, again, where grandparents can really reaffirm, you're there with them. You got them. Even if you don't always have the answers, which we don't right now. I think just that safety net of knowing that there's a place and a person they can talk with and share their thoughts and feelings with, someone who'll understand and reflect that support back. And then I think answering questions directly for kids, right? So, which may include sharing that we don't have all the answers, but if kids are asking important questions, kind of really letting that take the lead in helping them think through where they're at with things. So, if a kid asks, like, why can't I see you? Or am I ever going to get to see you again? Or what's happening with, this event or this issue? I think we have to just be very upfront about it and be direct. And then I think getting creative. We were just talking before this call, Halloween is around the corner. And I don't know about you, but in our family, Halloween is a big, big deal and something that means a lot to kids. And it's unlikely that we're going to be able to do it in the way that we typically do. And that's going to be hard for them. But we're trying to think about creative ways that we can still celebrate Halloween. Somebody was talking about a candy shoot, which I definitely need to think more about because that was very, very interesting to me. I'm trying to, right? And I was thinking for our family, like maybe you can do like almost like a candy hunt outside during the day, right? Since they may not be able to go trick-or-treating. And of course you have to decorate the house top to bottom to sort of liven things up. All of these things really matter. And all of that we can still do, COVID or not. And so I think really focusing on the things that are within our control. There's a lot that isn't, and that's kind of humbling. And actually that's not a bad thing for all of us to kind of practice sometimes. Like we like to think that we're in charge of everything and we know what's going to happen and we're planning and off we go. But the reality is that stuff happens. And, I think back to a year ago and nobody would have believed what we're doing now a year ago. But focusing on the things that are within our control, which includes candy shoots and Halloween decorations and playing an online game with your kids or, watching them sing or dance or perform for you or reading them a bedtime story or listening to them to complain about how annoying their parents are. That is still well within our control. And those are the things that we want to really focus on. So I'm happy to answer more specific questions. I'm happy to talk more. I want to make sure that I don't go over my time. But again, please don't hesitate to put questions in the chat if I can be of help. And I'm going to hand it off to Mr. Festa.
Very nice. Thank you so much. Mike Festa, State Director, ARP, reporting in. And the subject for me anyway is to focus on something that I suspect is on everyone's mind, and that is the election, November 3rd. It's less than 3 weeks away. I just wanted to give a little context. First of all, ARP, we are a non-partisan organization. We are focused on the issues that affect people 50 plus. You probably think of us on the insurance side, which I have nothing to do with, but certainly we spend a lot of our efforts in the nonprofit side where I am involved in advocating for issues like Social Security, solvency, Medicare, and concerns that are traditionally in the advocacy world of lobbying in federal and state. But this year, we decided as a national organization to put our focused attention not on what we normally do, which would be speaking of those issues or even educating our members about the position of the candidates, whether it's federal, the Congress or the president, on the, if you will, a voter education campaign on the issues and what they stand for. This year, we instead focused on how do we ensure that people have confidence that they can vote safely given the pandemic. This is on a lot of people's minds. It is clearly something that we are respecting, that there are different points of view. And the challenge we face right now, candidly, is that there's a lot of misinformation. I think we all know that. Let me speak to the information that I think is quite accurate. And certainly I'm happy to expand in the questions that may or may not come up at the end of my presentation and when all of us have a chance to do our first pass. Here's the things I want to point out. Number one, the law in Massachusetts did change several things that are being done now that have never been done before. The first thing to speak to is the idea of getting an absentee ballot before the election. In the past, if you wanted to do that, you had to have a reason that was statutorily permitted. Now, the law says, if you want an absentee ballot, you have no explanation to give, you simply ask for an absentee ballot. Now, all of us registered voters should have gotten that postcard from the Secretary of State saying, if you'd like to request an absentee ballot, you should do so using that postcard. If you didn't do that, no big deal. What you should be doing, and these are things that I would continue to repeat in the presentation, is first and foremost, go to your city or town's website their town clerk, the city clerk, will give you exactly what you need to do to request an absentee ballot. It's very easy, and we are well within the time when you can ask for it. But I would say, as a little bit of a asterisk, if you will, if you're going to request an absentee ballot, don't wait much longer. Technically, you can ask for an absentee ballot, I believe, as late as October 28th. But of course, by the time they send it to you, and then by the time you do what you do with it, which of course you have several options, it might be cutting it close. So when it comes to absentee ballots, that's the first change in law that is really important to consider. The second point is that unlike every other election in Massachusetts, at least modern election, you can vote early in person. Now, starting this Saturday, October 17th, through October 30th, you can go to your town, whatever polling site or sites have been designated, and you can vote in person. Now, I did that in the primary, and I will tell you, I picked a day in the middle of the day where I figured, well, the odds are pretty good, it won't be a line. And sure enough, I go into the only one site in Melrose where I live. Normally we have 12, but we only had one site. But when I went to vote, there were 3 people. And it was nice and easy, social distancing, no problem. But really, when you think about it, the reason why this is an important option is because a lot of people feel that they really do want to vote in person, but they are understandably concerned, as we talk about, this whole issue of COVID transmission and vulnerability. So the idea is that between October 17th, which is this Saturday, through October 30th, what you need to do is go to your town or city, make the phone call, or go on the website. They will tell you where those voting locations are. Now, they have to be, keep in mind, the 17th is a Saturday. They are open on Saturdays. They are going to be open, if I'm not mistaken, every single day. Now, there may be some exceptions in small towns, but I suspect that most everyone on this call is in a location where they're going to have it every day. So when in doubt, of course, you just go to your town website. They will tell you exactly where you can go to vote in person. But that's new. That's never been available. Now, the third thing I want to say is that when it comes to voting on election day, it's probably the case that many cities and towns have consolidated their voting locations. The reason for this was twofold. I think the first reason was acknowledging that many people who are the poll workers are themselves in the vulnerable category, at least statistically. And so you have, as we all know, when you go to vote, Mary's still there. She's been taking your ballot for the last 28 years. And she may be in her late 70s or early 80s, and she's still as sharp as a tack and loves to do this public service. But the truth of the matter is that that's asking a lot of Mary this year. And so what a lot of towns and cities have done is said, look, why don't we go from, having to staff for 13 hours, 7 a.m. to 8 p.m., 8 locations, 10 locations, let's go to a central location. Now that makes it less convenient, which again is a reminder to all of us that you've got to have a voting plan, right? The plan is, you want to do it in person, then probably the best thing to do to minimize contact with other people, social distancing, is clearly to do it between October 17th and the 30th. You want to wait to election day, no problem. Just expect more likely than not. It may not be as horrendous as what we saw in Georgia yesterday, but let's face it, we know how interested people are in this election. And I think you have to go in with a healthy attitude that you're going to be waiting in line, and social distancing is going to be more challenging. So it really is, I've covered the main ways at this point in the election process that you should consider. I am going to put in chat as soon as I finish a couple of websites. ARP has a website. which speaks to all things election for every state. So you can go to the AARP website, and we provide the information that I've mentioned as it relates to Massachusetts when you click that on, because they'll ask what state you're calling from, inquiring about. The second is the Secretary of State's website. This is something else that I think is really important. And just while I was waiting, hi, Judy. Judy got me to do this presentation, and I always appreciate a chance to see her. But I'm thinking right now, as I was waiting in the wait room for this program to begin, I said, I'm going to go on the website just for the heck of it and find out whether my ballot, which I filled out and dropped off absentee actually October 7th, right? On the website, you can click on that link that says track my ballot. And I tracked my ballot, and sure enough, it said, your ballot's been accepted. It was accepted on October 7th. I don't think another thing about it except let's see what happens at 8 o'clock at night on November 3rd. So that website is really good too, because if you don't know the local information, the Secretary of State website will get you to your right town, city clerk, or elections department so that you can get the more localized information. Because you should know this. We just did a teletown hall with our members at ARP, and we had the president of the Town Clerks Association, and she pointed out something I didn't realize, that is, in the bigger communities, they're going to have at least 8 hours, business hours of this in-person voting between the 17th and the 30th. But if you're in a smaller town, you could wind up in a situation where they're not open on a Sunday, or they're only open for 3 hours on those days. So you've got to do your homework, have that plan to vote. So I've covered all I think I need to cover on this presentation. Suffice to say, I'm happy to take questions or comments at the end. But at this point, I'm going to introduce Dr. Matt Russell to bring it home, my friend.
I'm muted. Thank you so much, Mr. Festa. That was fantastic, and thanks to all of our speakers. It's just been wonderful. So I'm Matt Russell, the medical director of the Senior Health Clinic here at Mass General, and I just wanted to let you know what we're doing in terms of COVID preparation from our clinic. And also just to remind you, if you're not connected with our clinic, please check with your primary care provider to make sure that they have something similar to what we're talking about. So I think just building on what we've been talking about in terms of influenza vaccinations, I do want to let people know that we have 2 influenza vaccine clinics coming up. The first is next Thursday, the 22nd, from 1 to 4. And then the following Friday, October 30th, from 1 to 4. So if you are looking to have a flu vaccine and you've not had luck with your local pharmacy, as many of our patients have said to us, because it seems to be on back order, we'll ask you to just give the clinic a call to book the appointment. What we're doing is, because many people are concerned about elevators and crossing paths with other people and all that stuff, we are going to have some elevator monitoring going on to make sure that people are spaced out, that they're not getting into crowded elevators, and also that they'll be going through a checkpoint where they're given a new mask and asked to wash their hands, the usual stuff. So that's again next Thursday, and then the following Friday, both from 1 to 4 p.m. We are continuing to work with our patients in whatever way possible. What we're finding is that our video visits are great, our in-person visits are great, our telephone encounters are a bit limiting, obviously, because we can't see each other and there's a lot less information that we're able to capture without each other's communication and facial expressions and whatnot. So we're encouraging many of our patients who are using telephones to either consider coming in person for visits, or learning how to get more tech savvy, as I think we've all had to learn this year how to become Zoom aficionados. And if there are younger relatives, family, friends, and adult children that can help you get you started, I certainly did this with my mom. She gave me the usual, oh, I don't think I can do this. Yep, she's doing it, and it's fine. And it's just getting over that hump of learning how to do it. So just encouraging people. We don't know what the next couple of months are going to entail, but certainly it is not unreasonable to think that it may be challenging for people to come to our clinic if we're reducing our in-person visits to stop the spread of the pandemic. So we really are hoping that folks can take this opportunity to develop some technology skills with the help of friends and family to be able to visit with us virtually. We are continuing to see patients in the clinic in person, and we are monitoring to make sure that people aren't in a waiting room with another person, that they're quickly whisked away into their own exam room, which is cleaned between visits and before and after visits. And patients come in through the clinic in one way and they go out through another way, so there shouldn't be a lot of cross traffic. So that's where we're at right now. So not a lot of news other than maybe the influenza clinic and also the plug to see if we can get folks and help your friends. If your friends are part of our clinic and they're not maybe the most they're a little tech phobic, give them a pointer and maybe help them figure that out. And I think that's all I have for Senior Health. I just want to say thanks so much for coming to our town hall, and I'm going to pass it back to Susan.
Matt, while you're still with us, not that you're going anywhere, but we did get a question about the quadrivalent vaccine at Mass General that you answered in the chat. Mm-hmm. Can you just share what you said so everyone who may not have seen that will know?
Yes. So at the Senior Health Clinic, we are giving the high-dose quadrivalent vaccine. So that's the one that we are really pushing for our patients over the age of 65 and those with underlying chronic medical conditions to receive.
And so is that, if you go to one of the other just flu clinics, mm-hmm. that's part of Mass General or Mass General Brigham, mm-hmm. and you're over 65, is that also, will you also get the high-dose quadrivalent?
Not necessarily. I think it's really important to verify with whoever is giving you the vaccine that this is in fact the high dose, because this vaccine is restricted more than the general flu vaccine to higher risk populations. And so a lot of times people who say live in nursing homes have priority to get that. And so commercial pharmacies and flu clinics outside of geriatrics may not have the number of doses to meet the need of patients just showing up. So that's why we're trying to funnel patients to the geriatrics clinic.
Okay, thank you. So I'm going to turn this over to Dr. Saranella because I've got several questions that I think might be up your alley. The first one is, we got a question about what is the safest mask for 5 to 10-year-olds to wear at school and when they're around other people for a period of time.
Great, thank you. And just to follow up on what Dr. Russell said, if you come to a Mass General flu clinic, so one of the ones at the museum or something that's not in your senior health clinic, you should get the quadrivalent high dose if you're over 65. It's definitely important to ask, but that's the way the automatic order is set up. So it should be able to be obtained at that setting as well.
Great.
The masking question is a really good one. So I think, we've been, as I mentioned earlier, we've been doing a lot of work with schools and daycares and really are very impressed and happy with how well kids are doing with masks. They really are able to wear them all day. We now have pretty good nobody studies this very much before COVID, but we have now safety data in kids that their oxygen levels are fine all day when they wear a mask all day, like they really tolerate it very well. And so I think really the best and safest mask is the one that they will be able to keep on during all of that period of time. If you're thinking about a cloth mask, then a mask with more layers is better. It will provide more protection to the child and to the people around the child. So 3 layers is better than 2, is better than 1. If they're able to tolerate a surgical mask, a lot of kids actually really like them. And so that's another great option. Some people actually find them more pleasant for sports than the cloth ones, because even though they do get a little wet and sweaty, they are quite light and breathable. And many kids will be able to wear either a child-size surgical mask or an adult one with the ear loops twisted, which is a good way to help them fit an adult mask to their head. So I would say, you know, whatever they're able to tolerate, but more layers is better if it's cloth, and surgical mask is probably even better if they like it.
Okay, thank you. We also have a question about, is it still important to wipe down delivered food?
This is like that question that comes up all the time, because early in the pandemic, we really didn't know. And so we told everyone wipe down everything. I don't think so. I mean, I think if you are really high risk or really feel that you have like a medical condition that might make you much more likely to have complications, it might be something to consider. If it makes you feel better to do it, then it's not going to hurt anything. And some people find that really comforting. If it makes you more nervous to do it, then I don't think you need to do it. It certainly takes a lot of time. What we have learned, I think, a lot over the last few months is that touching of surfaces is a possible way that transmission might occur, but it's not likely to be a very common way that it occurs. Now, it's really hard to study this well, because when people were breathed on by someone, they may have also touched something that that person touched, and it's really hard to tease that out. But the way that you would introduce COVID into your body from your delivered groceries is if there happened to be virus that was alive. So again, it has to be able to grow and replicate. And then you were to get it on your fingers, and then you were to touch your eyes or nose or mouth. And so if you can interrupt that chain anywhere, then you'll prevent transmission. So the easiest way may be to just not touch your face and wash your hands really, really, really well, and then you'll break the chain at that step. But it would be sort of like a belt and suspenders approach to try to break the chain at several steps.
Thank you. So the next question is one that we get frequently that I think is probably on all of our minds, and that is, what are ways that we can prepare, and what are things we can do if we want to try to be with family members over the holidays who are not part of our household and not people we have been, you know, staying with and staying away from everyone else?
Yeah. It's a really good question. And I think it has a lot, you know, people will have to decide kind of what level of risk we're all comfortable with. I think that the most important thing is to just remember to keep sort of the same prevention approaches that we've always been recommending. So if you are going to get together with someone who doesn't live with you currently, to try to be masked as much as possible, to try to stay distanced as much as possible, to try not to share items. And if you do, you know, wash your hands before you touch your face. And to do things outdoors as much as possible. Obviously in Boston, this is really hard for the Thanksgiving and December holidays because it gets very cold. But if you can increase the ventilation in the place where you're meeting, open all the windows, wear a jacket during the period of time that you're unmasked. So for example, while you're eating, that's a vulnerable period. And we have seen a lot of transmissions that occur like in, you know, office break rooms and things like that, where people are unmasked only because they're eating. And then, so that was what I would recommend, is try to limit the number of people you're in contact with, choose really carefully, ask them to be really careful before they come and see you. If you're having holidays with people who live out of state, then there's sort of another level of potential exposure that they may experience in their home state or during their travel. As I mentioned, if people come to Massachusetts, they can either quarantine for 14 days if they come from a state with high levels of COVID, or they can get tested. That's kind of the one exception to what I said about not testing out of quarantine. So if you have a real documented exposure to a person with COVID, you cannot test out of your 14-day quarantine. If you're coming from another state, then this Massachusetts state says you can test instead of quarantine. But it's important to remember what I said before, which is that test is just a snapshot in time, and that person could still be, you know, they could have gotten exposed yesterday on the airplane, they could still be on their way to becoming infectious, but not test positive yet. And so I would just still do all of those masking, distancing, hand washing, good ventilation, outdoors as much as possible kind of approaches.
Okay, thank you.
Can I add, Susan, one thought I have
Sure.
a lot, but it may also, there's nothing worse than when something is supposed to be wonderful and fun and enjoyable, and the stress of trying to do it the way we typically do makes it unpleasant, stressful, anxiety provoking. And so I think for a lot of this, we want to think about which is really going to meet the purpose of enjoying being together, which may mean not in person right now. And I know that's hard, but it might just be more fun to be relaxed and not masked and not have to worry about, you know, somebody coming within 3 feet just this year. We'll do it again in person, just maybe not now.
Thank you. I think that's very helpful. It's personally hard for me when I'm around people that I haven't seen in a long time to not get close to them. So it's easier just to see them on Zoom or on the phone or whatever. So we have another question that I think is very important, and that is, and this is for Dr. Russell. Do people need to have health insurance to get the flu shot at Senior Health or at the flu clinics?
I don't know. I think that's a great question, and I'm a bit stumped. I know that it's part of the standard Medicare coverage. So I think for folks, and then comparable insurances. So if people never paid in and have a private insurer, these are all standard benefits that go with it. But I don't know if this is an uninsured. I don't know if this is something that I imagine we do, but I just don't know the answer to that. So I don't want to make up something.
Okay, I think that may be something that we should get information.
Follow up and get back on, yeah.
Yeah, so we do have another question, and I think this is for Dr. Serenello, but if one flies and is with family and then comes back to Massachusetts, how many days do you need to quarantine before you get tested?
Yeah, that's a great question. That I think is on the Massachusetts state website. And so I would just check it because it changes from time to time. But currently the recommendation is that you should either get a test in the state you're going to right before you come back, or get a test within 72 hours of your arrival back in Massachusetts. And you can imagine there are a lot of places that you could miss something along that way. And so I would just, you know, it's not going to be a perfectly accurate assessment of whether you might have been exposed to COVID.
Great, thank you. And so I also asked Dr. Serenello to share with us resources because I found her description of the difference between isolation and quarantining very, very helpful. I think a lot of people get confused about that, including me. So she shared some links with us that we'll be able to share with you all that may be very helpful. So I also just want to remind everybody that if you have ideas about other topics that you would like to see us cover on these town halls, please send them in because we have more town halls on November 19th and December 17th at the same time. But we're always looking for good ideas and things that I think both clinical information about COVID and other things, but also questions that you might have about how to stay entertained and engaged during this period when so many of us are being isolated and apart from our families in ways that we've never experienced before. So I'm going to see if there are any other questions or comments. And I also want to see if any of our speakers have any last thoughts. And I'm going to start with Mr. Festa. Any last comments, suggestions?
Hey, I'm just going to beat one theme, vote.
Thank you. Thank you. Dr. Hinnon?
I guess my one thing would be cope.
Okay, Dr. Russell.
I need a one-syllable thing that goes with cope and vote. Stay connected.
Yes. Dr. Saranello.
Gosh, I didn't know I had to have a one-syllable summary.
I didn't either.
I would just echo the theme to vote. I mean, I think there are many, many issues that are important to people, and I certainly don't want to tell people in what way to vote, but I will just say that there are many, many things that I think we could have done better as a country during this pandemic. And I think that it is really important to vote for people who listen to science and who invest in public health and who are really clear about, like, the fact that at this point in the pandemic, it's not clear the difference between quarantine and isolation. Like, we have not done a great job coordinating our response to this pandemic. So if public health and science is one of the issues on which you vote, please do keep that in mind as you vote.
Thank you. And we do.
There's
Go
one
ahead,
more
Judy.
question that you might want to look at that just came in. It looks like it might be a quick one.
Yeah. Is this the question? Should people get tested before traveling or after arrival when you're flying to get together for holidays? And then there's also a question about, a suggestion about how we can do a better job of caring for a dementia friend living in assisted living as a future topic. But
for a future topic, got it. Thanks.
yeah. But
And that actually should just, you know, we do have a dementia caregiver support program. And I think that that would be, you know, something that we could give that topic at both that town hall and at our town halls in senior health. So thank you very much, Jean. I agree.
Great. So Dr. Saranello, can you take the question about should people get tested before traveling or after arrival when they're flying somewhere to get together for the holidays?
It's a great question. You know, there's not really any formal recommendation on getting tested before travel, except on the part of the receiving state. So the state that you're going to probably has a rule about this, which is why I would suggest to just look at their website and make sure you followed it. In terms of kind of the science behind it, it's going to depend a little bit about what kind of test you're getting and when you get that test in relation to when you may have become infected. So if you are really worried about getting exposed during travel, for example, on the airplane in the airport, then, you know, the optimal thing to do would be go somewhere, quarantine there for 4 or 5 days, and then get tested. That's probably not possible for most people. So if you got tested before you traveled, you would, and you were, let's say you were really staying home before you got that test for a week or so, then you could feel pretty confident that you're not likely to be carrying COVID as you hop on the plane. But you can't really say anything about what you might have, you know, been exposed to en route. So again, I think testing is helpful and it is slightly reassuring, but in general doesn't get us out of the really important need to focus on all of those other prevention measures like washing your hands and wearing a mask.
All right. Well, thank you, everyone. I think we're at the end of our time, and we hope to see you at our next event, which will be on November 17th, I think. I have to scroll down. I don't want to give you the wrong date.
November 19th.
November 19th. Thank you. Thank you. All right. And we hope you all have a happy Halloween. We should have worn costumes today, so you may see us in costumes in the future. Take care. Bye-bye, everybody.
Thank you.